believe the Department of Emergency Medicine is so successful because we build on each other's expertise, and it has a family environment. Everyone respects each other's expertise and works well to try to change clinical care for the best of our patients and our hospital.
I think it's important for our applicants to know the variety of learning opportunities that we have in our department. And so the residents that come here will have the opportunity to teach medical students and other health sciences students that rotate through our emergency department. So there is a value in that, because when you have to teach, you have to learn, and you also have to be well-spoken and also well-versed in the care that you're teaching. You'll have an opportunity to learn as a resident, but you also have an opportunity to pursue fellowships, whether it's within our department or beyond. That adds to the robustness of our training, as well as opportunities that our residency graduates have upon graduation.
One of the reasons why we are so successful is also the breadth of the material that we cover. So whether we're talking about emergency psychiatric care, or sepsis, or trauma, or injury and violence, mental health, all of these different reasons, we cover so much breadth, and a lot of our team members have their own areas and their skill set that they bring so that we can make a project or a research question very successful.
We get to see many difficult cases. Everyone is super approachable. What I think is a key aspect on the learning process that we are here in the emergency department.
University of Iowa is the only tertiary care center in the entire state. So we really get to see the sickest of the sick and take care of the most complicated cases, which I think is really beneficial and educational to our residents. I think our residency conference is really special. There's a lot of interaction back and forth, so it's not just someone providing a lecture, and I think that makes it more fun.
In terms of our faculty here at the university, it's a very diverse group of faculty. It's a very enthusiastic group, I would say. We're all here because we want to teach, and that's really the draw for most faculty here to our department, is because we want to work with med students, we want to work with physician residents, we want to work with APP residents.
Residents interact with other departments and other providers immediately when they come into the program. We have a great orientation set up through the GME office where they meet all their fellow interns. This progresses to a department orientation where they get a gradual level of responsibility throughout the department, and they work closely with their senior residents, and then they hit the floors running, and they're part of the team because they get a very great training in their first month of residency.
We support future careers after residency by trying to connect graduates with alumni, and we have everybody across the whole U.S. from coast to coast, and different countries as well. So we keep all of our alumni contacts and try and reach out to them to see if their groups or hospitals are hiring.
Thinking about different characteristics that are really essential to be a successful emergency medicine resident and provider later on is really that willingness to work with all kinds of people, whether it's people you work with or the patients that you see, being able to have a meaningful conversation with them, to learn from them, and to be able to provide excellent quality care. I think coming in with an open mind and patience really goes a long way in your ability to work with different people.
Just to work hard, be a team player.
Being willing to work on a team, we all learn from each other all the time.
Willingness to learn and willingness to be a member of a team. Not one person gets something done in the emergency department. We all work together.
We are really the central hub of the hospital, and we interact with, nurses and doctors from all different specialties, and we interact with patients who are, having acute emergencies. So having good interpersonal communication skills is one of the most important things, I think.
You get to see something new every day, every shift. You get to do a lot of electives. You get to just see so much and learn medicine in really a first-class institution. Something I really enjoy about the faculty is they're so diverse in their training, and they all have something to offer and are willing to teach. Coming in, we're new, right? We don't know much. We've studied in books, but we haven't actually had so much hands-on experience. If I feel like I need help with something, I can go ask someone a question and feel like they will sit down with me and take the time to show me or teach me.
If someone is interested in joining the emergency medicine residency, I would tell them that this is a mentoring and nurturing place where people can set their own goals and develop their own ideas for what their career might be. And this is a place that they can come to help to expand those goals, learn the skills that they need, and become the best emergency physicians that they can be.
My biggest piece of advice for people who are thinking about this program and not quite sure if they want to apply or interview here is to reach out to the current residents. Whether it's over Twitter, Instagram, email, social media, whatever you want, reach out to us and ask us what we like, what we don't like. This is Iowa. We're honest people. We're going to tell you a straight answer about everything that you ask us. And believe me when I say we love it here. We all love it here. We love our residents. We are a family. They are my best friends that I've ever had in my entire life. And if that's the kind of environment that you want to do residency in, then come to Iowa. You'll like it here.